Good afternoon, everyone. My name is Maya Luria with TMC for Seniors, and today we're going to be talking about moving forward exercise for breast cancer survivors and thrivers. I have Marija Zaruba here. She is with our TMC Adult Therapies, and I'm so glad that Maria and I talked about this topic a while ago and thought that it would be really beneficial for anyone that might, have had breast cancer, and how do they handle the exercise, maybe lymphedema when they're going through this process. And so we thought this would be a good one to present on. So welcome, Maria. How are you today?
Thank you, Maya. I'm doing great. And thank you so much for inviting me to do this talk. And thank you all for being here to learn about this topic. I'm really excited to present on this. This presentation is really rich in information. So I'm really glad that Maya's taken the time to print everything out so you guys can take notes and ask questions at the end, because we do cover a lot of topics. And then another thing to note is that our physiatrist here at TMC1, Dr. Sarah Park, was originally going to be part of this presentation. She's not here, but for a very exciting reason. She's expecting, so she'll be having a baby here soon. And so it's just going to be me for today, but there are a few slides that I have adapted from a presentation that she has given in the past. All right, so we'll get right into it. So some of the benefits of exercise include the reduced risk of cancer recurrence. If you have already been diagnosed with breast cancer and you've gone through treatment, if you are regular with an exercise routine, you can actually reduce the risk of the cancer coming back. And another amazing thing, and this was new for me to learn while I was doing my research, is that it reduces mortality due to breast cancer by up to 24%, which is major. It can reduce cancer and treatment-related fatigue, build or maintain muscle mass so you can do what you enjoy. And that's really what it's about, right? Think about the things you enjoy doing, walking with your friends, spending time with your family. Maybe you have pets, maybe you have places in town that you like to go. But it can also be as simple as getting up and down off of a chair, right? And not struggling with that. Being able to get to appointments and not being overly fatigued when you have to. So, and then this, of course, improves quality of life. And the research bears that out really robustly as well. The American College of Sports Medicine in 2018 or 2019 released this really awesome graphic compiling all the research that supports exercise as an intervention for those going through cancer treatment and survivors. And here are some of the aspects that have really strong support. So reduced cancer-related fatigue, health-related quality of life, physical function, anxiety, depression, and lymphedema. All of these things are highly and strongly supported to improve with aerobic exercise, resistance exercise, or a combination of the two.
What is lymphedema?
We'll talk all about that. Yeah. A lot of people aren't familiar with it, so I made sure to include a good chunk of the presentation is about that, because it's really important to understand and kind of know what to watch for. And then let me just see. So this part right here in the blue says, overall, the bottom line is avoid inactivity, improve general health, aim to achieve current physical activity guidelines for health. And so that is going to be 150 minutes of moderate intensity exercise per week. If you're going through treatment, however, you can start with 30 minutes 3 times a week for something like walking. Now you might be wondering, do I need rehab because I'm a physical therapist, I'm a rehab professional, or can I just start exercising? What's the appropriate approach? And if you want to write down your question, and we'll get to the questions at the end, thank you. So it may be appropriate to seek PT, physical therapy, or OT, occupational therapy, if you have multiple comorbidities, if you were not previously active prior to your diagnosis and you're not really sure where to start, if you have orthopedic concerns, so let's say you also have long-standing knee pain or back pain, or lymphedema, which we'll get to, or if you're currently undergoing treatment, it may be wise to get rehabilitation. But if there are no concerns from your physician team and you remained active, then certainly continue to exercise. There are a lot of different professionals in the rehab world, though. So how do you determine who do you see? So this is a slide that was adapted from Dr. Park's presentation with colleagues when she was up at the Mayo Clinic. So you can see occupational therapy, physical therapy, and then subspecialties. And you guys can just kind of read through that. But I do want to point out that at TMC Outpatient Therapy, we do have occupational therapy, we have physical therapy, lymphedema therapy by yours truly, we have a pelvic floor specialist, and we actually have 4 specialists in vestibular disorders. So if you have dizziness, which can be a side effect of some chemo drugs. Yeah. And we also have a speech therapist. So chemo brain is very real. If you're finding that you have difficulty with retrieving words or just forgetting things, our speech therapist is great. And then PM&R, so that's physical medicine and rehabilitation, or physiatrist. So that is what Dr. Park does. If you need a little bit more of a medical workup, diagnostic testing, imaging, referrals to other specialists, PM&R physician would be a great person to see. Essentially, she would help to manage the medical side of things. Now, why rehab? And more generally, why exercise? Well, orthopedic concerns are a really large part of what we need to consider with breast cancer, exercise, and rehab. 2008 study, actually 2 separate 2008 studies, showed that 35 to 58% of survivors have shoulder dysfunction. That can be something like frozen shoulder, rotator cuff issues, pain, postural issues, right, where you kind of pull in. So that is definitely something that can be worked on with exercise and with rehab. Chemotherapy also has a lot of side effects. I heard someone here, saying how horrible it was. You deal with joint pain, muscle pain, peripheral neuropathy. So your fingertips, your toes might get numb and tingly, and your balance gets totally thrown off, right? That can increase your fall risk.
It's healthy for you in 20 years, in your body.
Yeah, but it's hard for you when you're going through it, for sure. And
I mean, it's unhealthy for you in 20 years.
Yeah.
It's horrible for you.
And some of the chemo side effects, they can go away after treatment, and then other side effects last for years afterwards.
Yes,
Radiation side effects. So, you're essentially causing this burn to your skin, right? And beyond. And while it helps to kill the cancer cells, it can also lead to shoulder dysfunction and postural changes. And same thing with surgery, right? So I have a picture coming up. It's not in the next slide, but I'll point it out. Of all the muscles that are found in the front of the body, anytime we cause trauma to the shoulder or to the front of the body, we're going to end up in some protective posturing, right? It can even happen if you've really bumped your shoulder hard. We're going to kind of pull in and try to protect that shoulder. We might hike it up a little bit. That's going to lead to tightening of those muscles and eventually make it hard for you to reach, okay, and to do your normal exercise routine. Then we've got lymphatic concerns. So what is lymphedema? Lymphedema is a chronic and it can be a progressive swelling disorder that occurs due to removal of lymph nodes, but not for everybody. We'll talk about that a little bit. Yeah, it can impact the arm, the trunk, the breast, one or all of these areas. Surgery, radiation, even the cancer itself can impact the lymph vessels. All of these things in combination can increase the risk of developing lymphedema. So the more lymph nodes removed, the higher the risk. So studies have shown 5 to 6 lymph nodes removed leads to a higher risk of developing lymphedema. If you don't mind writing the question down at the end, we'll talk about it. There's just a lot of information. An axillary webbing syndrome. So that is where the lymph vessels can become fibrotic and adhere, and it basically feels like you've got a cord in your arm and you can't fully extend. And here's a picture of it. So on the right, you can see lymphatic cording, axillary webbing syndrome, or just cording. This person has it extending, it looks like just into her elbow, but in really severe cases, it can go down into the thumb. Typically, it develops after surgery, and it tends to resolve over time, but it can come back. So it's good to get that checked out and work on it. But exercise and stretching is supported by the research as one of the best ways to deal with this. Yeah. Absolutely. And can you rehab after surgery? Well, absolutely. We would follow your surgeon's precautions. They might have a certain level that they don't want you to lift your arm above. They might say don't lift more than a certain amount of weight. We would follow those precautions for their set amount of time. But then after that, we'd really be focusing on getting your shoulder health tuned up. Let me just see here. So some risk factors for developing the cording is lower BMI, younger age, radical mastectomy, if you've had a nerve injury, a hematoma, or if any of the lymph nodes removed did end up being positive. So I just wanted to point that out. So what about chemo? Can you rehab during chemo? Well, yes, because again, some of the side effects are balance problems, weakness, fatigue. Cardiotoxicity is another one that can end up showing up later. So it's important to make sure that your heart health is really looked after here. Wow. And it's not with all chemo drugs, just certain ones. But one of the common ones that's used in breast cancer treatment. So again, this is just kind of reiterating, what is the role of rehab? Well, we can improve your balance. We can help to improve your core strength, improve your general strength. And exercise, again, reduces fatigue, and it can help you maintain your cardiovascular health. Now, while women are going through treatment, many end up having their lab values taken often, right? Because you want to make sure that your platelet counts stay within a certain range. So if your platelet counts are below a certain range, your oncologist, your physician team may tell you, what activities are safe or not safe to do. In a rehab setting, this is something that we would also look at as well. Because if you're doing a lot of strength training and really stressing the muscles, that can be very taxing on the body and potentially dangerous if you're doing too much with not enough platelets in your system. Can you rehab during radiation treatment? Yes, also. However, from the lymphedema perspective, so I've had patients who are going through radiation treatment and they're seeing me for their lymphedema. We have to consider that this is tissue trauma that's happening across the entire chest, right? And radiation oncologists are really great because they can really find the area that needs the radiation treatment and not just blast the whole area. The technology has come very far. So, it used to be that you got blasted. Yeah. Similar with the surgeries, actually, it used to be common to just take out all of the axillary lymph nodes, all the lymph nodes in the armpits. But our amazing breast surgeons in town are very careful and just take out what they need. Same thing with radiation oncology. But that being the case, you're still dealing with this tissue trauma onto the skin. The skin becomes very delicate and friable. It doesn't move the way that it used to. So it's very fragile. So we have to consider that when we're stretching or doing any kind of massage across it. And long-term side effects, after you're done with your radiation treatment, it might feel like now all that needs to happen is for the burn to go away, right? Well, unfortunately, some of the long-term side effects can manifest over months, over years. Your skin's never going to be quite the same. You might end up dealing with decreased range of motion. Your skin is more fragile, like I mentioned. And then potentially osteonecrosis, so the bones, pulmonary fibrosis. And this is a picture of a cross-section of someone's chest. So the breasts are at the top, and you can see the lung fields on either side, and the heart is in the center. So they really position this as best as possible. And there's different types of radiation beams, by the way. So I don't want to say that all of them are like this. But someone receiving treatment several years ago may have gotten some radiation onto the lung tissue, right? So they might find it a little harder to exercise because of that. And then if you are hormone positive, if your breast cancer is hormone positive, you might be placed on tamoxifen or an aromatase inhibitor. Tamoxifen is used for premenopausal women, and it does result in early menopause and all of the side effects that come along with that, unfortunately. Those include decreased muscle tone and strength, decreased tensile strength of the ligaments and tendons.
The side effects are horrible from all this stuff.
Yeah.
Medications.
Yeah, the horrible side effects.
Thank you for admitting that.
Yeah, and decreased neck, shoulder girdle, pelvic girdle strength, foot stabilization, right? All of these areas that are stabilized by ligaments and tendons just become a little bit weaker. So women can start to complain of neck pain, or they're walking and they just don't feel as stable. They start to get back pain as a result, right? Carpal tunnel, trigger finger, also common. And with the aromatase inhibitor, so in postmenopausal ER positive or estrogen receptor positive breast cancer, this would be like the big names, letrozole, Arimidex. It can also lead to acute tendinitis, arthralgia, so pain in the joints. I actually have a patient who complains that every time she gets up from a chair, it's very painful for her hips, and she has to walk a lot for work. She's up and down all day, and just dealing with this hip pain. Bone density loss, and then the other menopausal changes that were previously mentioned. Those are all the same. All right, lymphedema. I really like this picture. So it looks a little bit scary because it's been drawn in a way that the arm is really red. If you do have arm swelling and your arm is red or it's hot, that could be a sign of infection. So you definitely want to get that checked out as soon as possible. But essentially, what's happening here is a collection of lymph fluid, and it's right under the skin, okay? So risk factors include axillary lymph node dissection. So if all of the lymph nodes have been taken out, the incidence goes up. It's not a guarantee that you would develop it. And on a personal note, we have a family friend who had that procedure done 5 years ago. All the lymph nodes removed, hasn't developed any lymphedema, thank goodness. But it can also appear months, sometimes years later. I had a woman who came in and she developed her lymphedema about 20 years after completing all of her treatments.
Wow.
Mm-hmm. More than 5 lymph nodes removed. Other research has suggested 6, but still. Radiation, a higher BMI prior to beginning your treatments. Subclinical edema. That one can be kind of tricky to say whether you have it or not. So something like bioimpedance spectroscopy would be used. We don't have that here at outpatient therapy, but it's part of the risk factors, so I included it. And then cellulitis, so an infection of the arm. And you can see in the picture, let's see. So in the picture, you can see the skin on top, and then there's the layer of the fluid, and then you can see the little sliver of yellow with the blue and the red. So that's a little arteriole and a venule, a vein, right? And those areas supply blood to the tissues surrounding it, okay? Normally, you have about 2 cell widths of distance from any cell to the blood supply around it, okay? And that helps to supply nutrition to those areas. But if you have swelling, that's going to increase the distance between the cells, the target cells, and the nutrition that they're supposed to be getting. So it can lead to things like dry skin, some skin changes, and we can talk about that later if you guys want to know more. The nice thing is that our philosophy with activity, if you do have lymphedema, has really changed a lot. So again, previously, axillary lymph node dissection was what everyone did. Now, if you have an axillary lymph node dissection, we're not necessarily going to tell you to stop all activity, right? Previously, you couldn't lift anything heavier than a handbag. If you had to have this, if you had radiation, forget about lifting a purse, forget about lifting milk. If you enjoy playing pickleball or gardening or anything like that, forget it. And yeah, just don't perform exercise with the arm. So that would have a major impact on someone's quality of life, right? Yeah. The beautiful thing is that now, we follow the physician recommendations for, what's safe for lifting your arm, what can you do immediately after surgery. And then after that, we go with the concept of progressive overload. And that's important for rehab or for exercise, okay? The idea that you start low, start with a low amount of repetitions, start with a low amount of reps and weight, and then eventually bring yourself up. Here's another picture of the lymphatic system, a nice schematic to show that it's actually found throughout the entire body. So the green are the lymph vessels. They're found everywhere, and they run alongside, and they're complementary to the circulatory system. So what happens is that at capillary beds, our circulatory system will naturally leak fluids, proteins, and then there's just extracellular junk that'll end up in the interstitial space, right? The area between cells. Our lymphatic system helps to move that lymph fluid, okay? It gets that extra fluid out of the way, it moves it back into the heart where it can then be processed by the kidneys or the liver, right? So it's part of like your body's recycling and waste management system. The lymphatic system is also really important for immune surveillance because the lymph nodes contain white blood cells. Okay, so if you get a cut or an infection somewhere, that is what helps to send some of those cells over there to help deal with that. And this is just another schematic showing that the lymph system will eventually bring that fluid back into the heart. So it dumps into the venous system and then back into the heart. And you can also see that there are valves in some of the larger lymphatic vessels, and that becomes important. And we'll talk about why in a second. The lymphatic system of the breast. Okay, so you can see that there are a lot of lymph nodes in the armpit region. That's usually where those are removed from. But you also have lymph nodes along the sternum and throughout the neck, and then above the collarbones. Okay.
Oh, wow.
Mm-hmm. And this shows the flow of the lymph fluid. Again, it always goes from the periphery, so out in the fingertips, the toes, and then up, 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 and in, back to the heart. And so the lymph nodes, they help to filter lymph fluid. They contain white blood cells, like I mentioned. They augment the immune response. Unfortunately, they don't grow back. So if you have had a surgery to remove those lymph nodes, they don't grow back. And because the lymph vessels will lead to particular lymph nodes, the fluid there will basically come upon a dead end. And I also want to point out in this picture, there are circles around where the lymph nodes are in their highest concentration. So we got the hips, right at the groin. We got the armpits, the neck. What do all of these things have in common? Give you a hint. movement. Yeah. So they're found in joints, and so if you're active and if you're moving, that's going to help the lymph to flow.
Wonderful.
Yeah, and specifically, how does the lymph flow? So it works through pressure gradients. Unlike the circulatory system, which has the heart, which assists in pumping, that's what pumps the blood, we don't have a central pump for the lymphatic system. So instead, our body uses what's called a muscular pump, okay? One of them is belly breathing, diaphragmatic breathing. This one often surprises people. So I want everyone to go ahead and take a nice deep breath, put one hand on your chest and one hand on your belly. And try a couple. Now what I want you to feel for, can you get your belly to expand? Does your belly move out as you breathe in? Or do you only feel your chest rising? Some people, when they're doing their deep breathing, actually pull their bellies in when they breathe in. You're meant to actually expand your belly. And that's because the diaphragm, the muscle that's found below your rib cage, when you breathe in, that contracts, that pulls on the lungs, and that actually pulls air in. And so by pulling that air in, that's going to push the pressure into the abdominal cavity, pushes the belly out, right? And then you breathe out, and your belly is going to come back in. So that's kind of a pumping action, right? So if we go back a couple of slides, that's not such a good one to show it, but right here, look at the belly region, right? So the largest lymph vessels in the body are known as lymphatic trunks. So we have the thoracic trunk that's found in the abdominal cavity, right? And when we're doing deep breathing, when we're exercising, that's helping to push against that area and helping to pump the fluid up. This also works through muscle contractions. So I just saw someone in the front doing some ankle pumps, and that's exactly right. So it's been called like the second heart of the body, which I think that's, a little bit more the diaphragmatic breathing, but hey, that's just what I happen to find. So when you contract your muscles, those muscle contractions are going to push against the vessels and help to move the fluid up, right? Because if you have, so for the people who are watching online, so my fingers here are the valves, okay? So if you push the muscles, that's going to open up the valves, and that's going to move the fluid that's in that little segment. And then as the muscle relaxes, the valves are going to close back down and prevent regurgitation of that fluid. Very similar to the veins. Compression is also helpful. So a lot of people end up using compression sleeves, gauntlets, Velcro garments, and that sort of thing. And that helps to augment the muscular contractions, and it can help to prevent fluid buildup in the arm. And then there's also the intrinsic pumping of the lymph vessels. Some of the larger lymph vessels actually have smooth muscle in them, and they pump at a rate of about 12 times a minute. When you exercise, when you get your heart rate up, the fastest they can go is 60 times a minute, so once a second. So you can imagine how this is also helpful for helping to move that lymph fluid, right? You're exercising, your heart rate is up, now everything is pumping a little bit quicker, so you're getting that lymph flowing throughout your entire body. I do want everyone to know the symptoms and the signs of lymphedema. Haven't is what I teach people, or hasn't. So heaviness, aching, fatigue, numbness, and tingling. And so that heaviness goes even if you don't feel like the arm looks swollen, because the lymph fluid has a lot of protein in it. If your arm feels significantly heavier than usual, that's something to pay attention to and potentially talk to your doctor about, or your therapist. I might come back to that. Okay. I always use the traffic analogy when talking about lymphedema. So surgery is like putting traffic cones up on Grant Road, okay?
Yeah.
If it's not a busy time of day, it's probably fine. Maybe traffic slows down a little bit. Everyone has to merge, right? But the traffic that was previously going down that lane now has hit a dead end, right? That's like the lymph fluid that used to go up to a particular lymph node has now hit a dead end. What we have to do is try to reroute it. Okay, so we can reroute traffic. Another important idea is lymphatic load. So again, this is all well and fine if Grant Road isn't too busy, right? But what causes rush hour traffic? What would cause the body to produce more lymph fluid and potentially create a backup?
Stress.
Well, inflammation. Yeah, so heat, tissue injury, insect bite, constriction, right? Really, really tight jewelry, for example, and infection. That's so important to understand. So the wonderful Dr. Catherine Schmitz, who heads, I believe it's Penn State's exercise physiology program. So she's done a lot of research in lymphedema, and she headed the PAL trial, which we'll talk about in the next slide. She talks about making sure that you understand that you're loading your arm when you are doing certain things, right? When things happen to your arm. So for example, if you already have lymphedema, or if you're at a high risk for lymphedema, if you're planning on doing weeding in your backyard, protect your arm by putting on some insect repellent, right? And maybe don't also take a really hot shower and then wash a ton of dishes without any gloves on and then cut your cuticles, right? Because who knows which one of those things might be the thing that brings you into lymphedema, right? The straw that broke the camel's back. It's really hard to say. So better to just manage the risk and plan accordingly. Strength after breast cancer. So this is based on the PAL trial, physical activity and lymphedema trial. So it used to be thought that if you exercised, you could increase your risk of lymphedema. What the PAL trial showed is that actually exercise can be an amazing tool for preventing lymphedema. Yeah, but it has to be done in a certain way, okay? So there's robust evidence showing that if you already have lymphedema, this program can reduce flare-ups by up to 50% and a 70% reduced risk of onset in those who were at a higher risk for developing it. And this is going along with the start low, go slow philosophy. It's performed twice weekly, and this is something that you would take on as a part of your life routine, like taking showers and brushing your teeth. There is no endpoint for this. But the cool thing is that there's no endpoint for what you can achieve for most people, right? You start off with 1 pound, let's say, bicep curls, and who's to say if in 5 years you can't be lifting much, much more than that, right? You don't have to put a limit on yourself, but your body will also let you know if it's reached a hard endpoint and you can't do more than that. You would know this by consistent symptoms of lymphedema, right? So think back on heaviness, aching, fatigue, numbness, tingling. And that heaviness, it's not the same thing as muscle soreness. So that's another thing, okay? The cool thing about this program is that it is total body. It works the upper and lower body. And one of the reasons for that is to show people what soreness feels like in your muscles in your lower body, right? Because if you feel sore in your legs and if you feel sore in both arms, then that's probably not the soreness that's telling you that there might be a lymphedema issue going on, right? But if you're sore and there's a definite difference in how that affected arm feels, well, then maybe you're thinking maybe it was too much for that limb at the time. And I did get certified to actually administer the Strength After Breast Cancer program. So that is something that I offer as well. So just a really great program. So what can you do today? Practice your deep belly breathing. You can look it up on YouTube. It's a great thing to do whenever you're stressed out, and it gives your lymphatic system a boost as well. Be aware of protective posturing, right? So if it's been several years and you notice that you tend to kind of hold yourself in a curled up, making yourself small, you could be tightening up those muscles. So try to be aware of that. And let's try something right now, okay? So let's do this with both arms, as long as you don't have any range of motion restrictions or any pain in the shoulder. I want everyone to kind of curl forward and get into an awful posture, okay? All right, now try to lift up your arms. All right, yeah, it's hard to do. It's kind of like you get to an end point and you just can't go any further, okay? Now I want everyone to make themselves tall. Pretend there's a string at the top of your head and you're just being lifted straight up, okay? And now I want you to lift up your arms. That's way easier, right? So imagine if you've been protective posturing for months, years, right? And then you're trying to reach for your shampoo bottle or you're putting away dishes, right? And it's hard. You might be creating impingements in your shoulders. We can definitely work on that in PT, but also just being aware of it, right? Trying to open up, stretch those muscles, okay? If it's safe for you to do so, start or continue a walking program. Walking is just so amazing for so many reasons. But if there are other considerations, if you've got like severe balance problems or anything like that, you could talk to your doctor about trying something else or get into rehab and we could figure something out for you. And if you're not sure or you fall into any of the categories that we talked about before, come to see a rehab specialist for sure. I also wanted to plug TCC, Tucson Cancer Conquerors. I think that this is a really fantastic group. I love that they are headed by cancer survivors, and they really promote health and staying active and camaraderie. They do weekly walking, so they walk on the loop, so you get some sunshine and get to chat with other people. But they also have different exercise classes too. So at this point, I've had several patients who have been part of this group, and they all have such wonderful things to say about them. So definitely recommend checking them out. Check out their website. And TMC Outpatient Therapy. So again, we've got physical therapy with all of the specialties listed, occupational therapy, speech therapy. But at the end of the day, you need to move forward, right? So let's get you back on the road to health so that you can move forward. Yep. Thank you.
So thank you, Maria. So I've got a couple of questions that I wanted to ask.
Okay.
One is, if somebody was interested in maybe has lymphedema, they need somebody like you to help with that. What's that process like? What do they need to do? What is that treatment? How long is it typically? And
yes,
how do they get started?
Yeah, so you would need a referral from your physician. So it could be from your oncologist or your PCP. They would need to diagnose you with lymphedema, and then they would send the referral over to outpatient therapy. And then I would see you, or I know that there are some other lymphedema therapists in town. So they would see you, take measurements, and then figure out a plan. For some people, it's as simple as learning self-care practices and making sure you've got the tools you need. For other people, it would be more intensive, twice a week. Some people offer 3 times a week for reducing the size of the arm, and that could go on for several weeks. So it just really depends.
Okay. And if somebody has more questions, I just put up the phone number as well for TMC Adult Outpatient Therapies. It's 520-324-7005. So that people can reach out to you that way as well. Another question would be, what is there anything people can do in advance to help make it easier when they've been diagnosed?
Yeah, just stay active. We know that having a lower BMI at baseline also decreases your risk of developing lymphedema. But once you've already gone through the treatments, weight loss isn't going to change the severity or anything like that. So just staying active is really the major thing.
Okay. And what about diet? How does diet impact or does it aggravate lymphedema?
Yeah, thank you for that question. So diet is not really in my wheelhouse. However, I can recommend a book. It's called the Lymphedema and Lipedema Nutrition Guide. And there are multiple contributors. One of them is Dr. Catherine Herbst, who is a connective tissue specialist. And she did practice here in Tucson, but she sees people for lymphedema. So really wonderful resource. Typically the advice we get is watch your salt intake, and then reduce any inflammatory foods that you're eating. So if you're eating out a lot, getting a lot of like takeout and fast food, just know that that's all going to be really inflammatory, and that can have lots of health consequences, but certainly on the lymphatic system. So something to consider.
Okay. And is there a benefit at all to having sort of like the compression sleeves? Sometimes I know I have seen them. I'm not sure if that is a benefit for lymphedema or not, but is that something that people would be? I don't know if that's prescribed by your physician or where it's recommended.
What's the question?
So the question is about compression sleeves. Are they helpful and when are they used? So if you have been diagnosed with lymphedema, absolutely. You would want to get a compression sleeve just to prevent the progression of lymphedema and to support the lymphatic system. If you are at a higher risk, there's a couple of different ways that we can approach it. There was a study in 2022 that showed that people who had a high risk of developing lymphedema, if they were placed in a compression sleeve prophylactically, and if they wore that for 3 months after they finished their treatments, they actually had a reduction in development of swelling 1 year later. But at this point, we don't know if that effect lasts for 5 years, 10 years, and so on. But that shows promise. Another school of thought, so I've taken courses, advanced courses through the Physiological Oncology Rehab Institute, PORI, and their philosophy...
Lymphedema isn't always permanent. Some people have just where it may show up once and then go away.
The comment was that lymphedema is not always permanent. For some people, it can show up and then go away. The very early stages are reversible, which is why it's important to notice them and then treat promptly so that it doesn't
exercising, taking care of
and not doing not overdoing things, but just being really wise about your approach. But with PORI, their philosophy is that the compression sleeves are an assistive device. So if you're at a lower risk, you could just continue to live your life, but know the signs of lymphedema, right? Know that your capacity for transporting the fluid has been reduced because lymph nodes have been taken out. And then just notice, like, okay, when I tiled my bathroom and then I did some weeding and I, ran up and down Tumamoc, that made my arm feel kind of heavy. Well, maybe that was just too much for your system and you need to back off. Okay, so you can also just approach it that way, kind of wait and see, and followed with regular checkups with a lymphedema therapist and checking in with yourself, right? Make sure that you're not getting any pitting. So when you press into your arm, especially over bony prominences, so over the elbow is a great area to check, over the side of the elbow. Keep pressure there and then let go. Make sure that you're not leaving a thumbprint, for example. So just monitoring. Mm-hmm.
Great. I had another question come in about tissue expanders.
Mm-hmm.
If you have tissue expanders in place, it says hold on exercises due to discomfort and pulling, or what can you do? What should you try to do at that point if you have tissue expanders? And I know that that's oftentimes very painful.
Yes.
Maybe uncomfortable.
Yeah, because they're trying to expand the skin so that you can accommodate implants for reconstruction. Yeah, so stretching, just consistently stretching, daily stretching, and I also do myofascial work with people over like the entire chest area, over the projection tissue, and along the rib cage, just to kind of help loosen things up a bit, and that really helps people's comfort as well.
Okay. And if somebody has gone through surgery for breast cancer, is it typical then, even with this is absence of lymphedema, typical for them to come maybe see a physical therapist?
Yeah, so I definitely get those referrals as well to establish baseline measurements before anything happens, because it's definitely helpful to be able to go back and say, okay, we took your measurements back in March after your surgery. This is, these are the numbers that we had. And then now you're saying that you're starting to feel some heaviness. Well, it does look like your arm has gotten larger based on the previous measurements, so let's start treatment. Or no, your arm doesn't look any larger, but here's some other ideas that we can do. So yeah, I can definitely see people for that. And also just making sure that you're not going into your protective posturing, right? That we're making sure that your shoulder remains healthy.
Okay, and then if somebody was having maybe anything done prophylactically for breast cancer, would they also see you too?
Prophylactically for breast
Well,
cancer?
maybe they've had a mastectomy prophylactically to prevent, to prevent breast cancer.
Yeah. Yep, definitely, because that can lead to tightening of the tissues and make it very uncomfortable to do your typical, daily life. The tissue tightens up, and we can work on that as well and stretch.
Okay, great. I appreciate that, Marija. Thank you for sharing everything with us today. I'm going to close up with our online audience, and I'll turn it back over so you can answer any questions in person.
Great.
Thanks for being here.
So much. Thank you. All right, so you had a couple questions.
Thanks again for being here today. We look forward to seeing you next week. Our next class is going to be on eating plant-based, how to get started. That'll be on Wednesday, May 29th at 2 p.m. If you're interested in attending that class, please give us a call. Our phone number is 520-324-1960. We do probably have a few spots left in person, along with anyone who would like to watch online. Thanks again. Bye.